Hi everybody, this is Kelsey Sterniglia. I am now going to do my IM injection. I will start by assessing the medication administration record. This is for Millie Larsen. She has a date of birth of 1/1/1936. The order calls for haloperidol 2 milligrams IM. We're giving that now, and it's for control of agitation. I am going to give about 0.4 mLs 4 millis dose of 2 milligrams, as the haloperidol vial is 5 mg per milliliter. I am going to do my hand hygiene. I am then going to make sure I have all of the needed supplies. So I have a sharp spin, hand sanitizer, medication record. I have the patient's medication, the haloperidol. I have a Sharpie. I have the syringe, needles, gauze, alcohol swab. I have some tape so I can label the syringe and the Sharpie. And then I have my gloves next to me. So I'm then going to make sure I have the correct size needle. I have one needle to draw up with, and I have another needle, the 23 gauge 1-inch needle. I chose that one because Millie is elderly, so she's fairly thin right now, and I feel like that would be a better choice than the 1.5-inch needle. I am going to use a 3 ml syringe. This allows me to see exactly 0.4 when I'm pulling up. I am then going to make sure when I pull out the medication that I have the right vial. This is haloperidol. It's 5 mg per ml, which is acceptable for the dosage that Millie is going to need. I am going to then use the alcohol swab, clean off the top of the vial. I will take the needle that I'm going to use and the syringe. I'm going to make sure I'm not touching the needle nor the tip of the syringe. Take out the needle. I'm going to pull up the air equal to the amount of milliliters that I'm going to pull out, so that is 0.4. I'm going to keep the vial up on the table, and then I will lift up and inject the air, and I'll pull back the amount of solution that I want, making sure I get all the air bubbles out. I have 0.4. I am going to then enable the safety mechanism, take off the needle, put this in my sharps container. I will then put the correct needle on, again the 23 gauge 1-inch, not touching the tips. Get rid of these. I'm going to use some tape so I can label the syringe now that it is pulled up with medication that is outside of the vial. right. So there's that. I want to just make sure again that I'm checking the medication. I have haloperidol, 2 milligrams, which is 0.4 mLs. Again, we're going to make sure that the expiration date is correct. So 6 of 29, currently still acceptable. I am then going to go into the patient's room, and I'm going to use 2 forms of identification. I'm going to use the name and date of birth. So, hi Millie, I'm Kelsey. I'm going to be your nurse today. Can you give me your name and date of birth? Millie Larsen, 1/1/1936. Millie, do you have any allergies? No, no allergies. Okay. I am going to give you an injection. It's going to be an intramuscular injection, and it's of haloperidol. So this is going to help you with controlling any agitation that you have. Before I give the injection, I'm going to check her name band, which is on her. Make sure I am doing my hand hygiene. I am going to then put my non-sterile clean gloves on. Millie, for this injection, we're going to use the ventral gluteal site, which is around the hip area, hip to thigh area. I am going to position you in the lateral position or on your side. I'm going to put you on your side with your left hip up. In that case, I'm going to use my right hand, and I'm going to place it on your greater trochanter. And then I am going to point my thumb towards your belly button. I'm going to point my first finger, index finger, towards the anterior superior iliac spine, and then I'm going to spread my middle finger and my first finger apart, pointing my middle finger to the iliac crest, and within this V right here, I'm going to give the injection. So now that I have my spot, I am going to then cleanse it with an alcohol swab in circular motions, not going over the same area twice. I can then allow that to dry. I'm going to, with my non-dominant hand, hold the skin taut. Between my index and thumb, I'm going to insert the needle at a 90-degree angle. I'm going to aspirate for 3 seconds, 3 to 5 seconds, and ensure no blood is returning into the syringe. And once I'm sure there is no blood, I can then inject the medication, take it out. I'm going to activate the safety device, and then I'm just going to get rid of the sharps in the sharp container quickly. At this time, I can use either a Band-Aid or a piece of gauze in case the patient is bleeding. Millie does not seem to be bleeding anywhere, but just in case, I'll apply a little pressure and make sure that there's no blood. And get rid of that. Millie, are you comfortable? Any questions or concerns? No, perfect. I'm going to now lay you back into a comfortable position. Make sure that I give you your call bell. Make sure all of the IV lines, anything that you have around you are not tangled. And then I will take off my gloves. Throw those away. Hand hygiene again before I leave the room. And then I'm going to come back to the medication administration record for Millie Larsen 1/1/1936. I am going to then document that I gave the haloperidol 2 milligram intramuscular and check the given section. I'm going to put the time in my initials, and then we are all set, and that would be the end of the IM injection. Thanks.